When it comes to running a private clinic, one of the most important things to think about is analytics. So whether that's performance indicators, whether that's looking at the overall situation with regards to the kinds of patients coming in, all sorts of different things, it's very important that you treat your private practice much in the way any other business would be treated, because ultimately it is a business, and even if you're the most patient-centered person in the world, what you have to think about is the fact that if you can't keep your practice afloat as a business, you're not going to actually be there to help your patients. So, whichever way you think about the sort of business side of private healthcare, it does make a lot of sense to learn as much as you can about it. Now, obviously, coming from clinical backgrounds, you don't necessarily know everything there is to know about running a business. It's not something we're trained to do, typically. That said, what Medesk is doing is making the whole process of learning from what's going on in your clinic and making the right decisions based on that as easy as possible. So you don't really need all that much in the way of business know-how. You just need to know what it is you want to find out, what it is that your problems are, what it is you're good at, and kind of work from there. So it's a process of optimization, really. Now, Medesk Analytics shows you a huge amount of what's going on in your practice. So as long as you're using the platform properly, making your bookings, recording your notes, raising invoices, marking them off as paid, all those things, Medesk will actually capture a huge amount of information automatically. We also have a series of color-coded tags for all sorts of different things, such as where the patients come from, what the patient's situation is generally, what's happened in appointments, whether the appointment's gone ahead, whether there's been a no-show, a cancellation, lots and lots of different things that we can just track with color-coded buttons, and as well as the automated side of things. And what I'm going to show you today in this short video is some simple reports that can help you understand, just by looking at them, what's going on in your clinic in a given time period. So I'm looking at the moment at the entirety of June. And what we're doing here is you can see that there's a dashboard here, nice and simple. You can see here you've got some donut charts, and what you've got here is a breakdown of the first-time visits versus follow-up visits. So you can essentially see how many new people are coming in to be seen versus how many long-standing patients or clients that you have. So it kind of acts as a health gauge, really, for the practice itself as a business. So you can see how heavily you're relying on existing clientele versus how well your acquisition is working. And so if over time you notice that the rate of change is deteriorating, you can then maybe dig into it a bit deeper in the full analytics side of things and see what's going on. I mean, in this case, of course, you can see that everything's going well. So in this particular clinic, you wouldn't do anything perhaps, or you would just at least just continue to monitor it. Whereas if it was going down, you'd dig into, who's actually handling the first time appointments, where it is those appointments have been booked from. Is it from social media? Is it from your website? Was it by recommendation? Anything like that. And you can kind of dig into that and try and understand a bit more about that particular situation. Was it a particular social media post that you wrote about that generated a flood of bookings, that kind of thing. And it just means that you can kind of repeat successes and avoid failures, or rather avoid repeating those failures. What you can see here down here is a appointment status donut chart. And what we've got here is it tells you the status of all the appointments for the month. So you can see how many have been unconfirmed and they're probably upcoming. You can see how many are confirmed, they're also probably upcoming. You can see how many have been successfully completed. You can see here how many have been DNA'd or there's been a no-show, and you can see here how many there's been cancelled. So this particular clinic is doing pretty well in terms of those statistics. They could probably do with having a few more appointments, of course, but in general, those appointments are being well attended. Now, if there was a situation where the cancellation rate was, say, perhaps above 5%, you'd see that here easily, because you'd see 5%, you'd see that there's been a deterioration in that, and you'd see a big grey section of the donut. And what that would allow you to do then is dig into the proper reports that this is based on, see the clinicians, see maybe even the times of day, see what services were involved, see whether people had paid anything yet, anything like that, and try and spot some patterns. It may well be that the cancellations are all to do with one particular clinician or one particular service. It might be that the services that are booked around rush hour are the ones least well attended. And it may be that you want to change your opening hours. It may be you want to not offer certain services at certain times. It may be that you want to advise people that during those hours they need to make a bit of extra time. And of course, if there are specific repeat offenders, you can tag them with a no-show risk, and then you can actually have like a special message put out to them as part of the reminder system we have. And you can actually say to them, please make sure that you let us know if you can't attend. Whereas perhaps you wouldn't be so straightforward, sort of upfront about that with other people who haven't, been a no-show risk before. And the last thing on this summary here is the acquisition channels. So as I've alluded to already, what you can do in Medesk is you can record where your patients are coming from. So whether that's a particular social media channel, whether that's your website, whether that's a referral from a local GP, whatever it might be, you can record that both manually and automatically. So if you plug into Medesk Online Booking, for example, whenever someone makes a booking, it will track where that's come from, and you can have your stats straight away here. So you don't actually need to do anything necessarily. You can just see how you're doing. So you can see here that this clinic's doing pretty well out of Facebook. They're getting referrals from particular organizations. Their word of mouth isn't doing too badly overall. And then they've got some other specific referrals there, perhaps Google Ads, for example. So it really does help you understand, even just looking at this, if you're getting loads of bookings from your Google Ads efforts, you know that that's money well spent. And you can dig into the analytics in Medesk as well to see how much money is actually being spent versus being recouped. So you can actually put that into things like your service costs versus how much people are paying and all sorts, look at profitability and such like. So there's a huge amount you can do. This is just a little summary of the main breakdown we've got here. We will be producing some videos on some more specific reports, some more specific use cases and problems that people have been having, but this is one to get you started. If you are interested in Medesk, please do give us a shout. We'd be more than happy to help you, give you a trial of our platform, and also give you a bespoke guided tour as well. We release new videos every week. Hit that subscribe button to learn how to grow your practice faster.